So I will continue on with this presentation by talking about the methods that are used in euthanasia. So there are several different chemical methods that I will elaborate on, and I will go into further show the different studies that are done, whether it's done on rats or humans. So the first methods that we usually see and that we usually hear about on the news are the normal methods where someone is taken off of what would be like life support, usually like a ventilator is usually removed, and then from that, the patient would go into basically necrosis and then death, whether it was from asphyxiation or dying because they don't have, obviously, are not breathing on their own. So that would be the first thing that we see. The other methods that we see and that are being elaborated more on as of late are chemical methods to assist in end of life, which is what we usually see with opioids or muscle relaxers. We are going to discuss other methods that are a bit more extensive, that are only in lab trials done on rats, and you'll see why they have not gone further into clinical trials. So the chemical methods that are used that I have researched over, the first method that I would like to touch upon is the CO2 method of euthanasia. So here the CO2 method of euthanasia is done by subjects that are rats. And so here we have a problem with going over euthanasia with rats, whether it's ethical or unethical. And the problem that we see with the results is that the use of the gradual fill method in the CO2 was found that high volumes in rats may be unethical to use for assisted suicide. The problem is that the results for this have shown that the rats that are exposed to concentrations of CO2 did not cause a loss of consciousness, which is a problem because we want to have patients not feel any pain, which is what the chemical methods are going over. Here in the CO2 displacement, instead it caused an exhibit of increased anxiety and a decrease in social behavior. Every 10% volume per minute of CO2 that was let in the rat's body. So here, when the body is exposed to concentrations of CO2, nerve damage continues and followed by asphyxiation occurs because CO2 is a waste product of the body. So essentially the rat's body is suffocating until death occurs. And so here, this is an ethical issue because of the CO2 most likely being a very painful death. And this is why the CO2 method has only gone to lab trials and has not gone to clinical trials on humans. The other method that we have looked upon is the sodium pentobarbital method. And the biggest problem with the sodium pentobarbital method that has been done on rats as well is the fact that there has been a lot of misinjections into the method. So while this method has been effective in terms of assisting suicide, the problem with this method is that historically there are concerns revolving around misinjections leading to variable success rates and potential for pain. The problem is that if there is pain anytime in any of these experiments, then a lot of times this would not be considered a helpful method in terms of euthanasia. So this was another method that we're looking at in chemical methods that did not go past not go past experimental trials into clinical trials. The methods that they do use now and have been researched in places like Netherlands, Denmark, and the European area over time, especially in the 1990s, have been opioids and muscle relaxers. So I'll further elaborate on this. So here we have a chart on the drug usage in Netherlands and Denmark, and this is related to the physician-assisted suicide in 2001 and 2005. So here you can see the different types of muscles, relaxers they use, and different types of medication that they use here. So some of the drugs that they have used, and I'll just read them out for you, is a neuromuscular relaxant, a barbiturates, an opioid, benzodiazepines, and other drugs. But the drug that they mainly used the most was opioids, and um, that makes sense because opioids a lot are used mostly to relax the body, and it's a lot of more of a psychological aspect in terms of relaxing the body to where you're not realizing that you might be meeting death. So opioids are usually used, and the neuromuscular relaxants are combined with the opioids to where your muscles relax as you basically experience death. When you experience death and you're going through necrosis, your muscles tend to tighten up in what is called atrophy, or death atrophy, where your muscles are basically the lactic acid and everything that is in your muscles are pulling out into the interstitial space, and this can be a very painful death. And so the relaxants help counter that along with the opioids. So this is what we're seeing with this type of drugs being used in euthanasia and physician-assisted suicide. So if we were to compare and contrast the traditional methods and the chemical methods, we can look at it over here that the traditional methods, which is the methods used where you simply just remove someone from um, life support, or the methods used in 1990s with the opioids and the muscle relaxers, compared to the chemical methods used with the CO2 displacement and the sodium pentaorbital, we can see that while there are many advancements in technology using chemical methods in the laboratory aspect, in terms of trying to create a drug that will help in euthanasia in a more painless way, no such chemical experiment has shown a good result for that. Therefore, traditional methods are continued to be the forefront for euthanasia, and we see that um, a lot of patients usually ask to be taken off the life support as a mean for their death, and then that is how they carry out their euthanasia. So a lot of ethical concerns are of methods here. In specifically methods that we see in laboratory, the concerns are related around the pain that is caused, because euthanasia is centered around pain-free assisted suicide. Any type of pain that is given during chemical methods would not be an experiment or a drug that would move forward into clinical trials. And this is seen in displacement of CO2 and sodium pentaorbital, where humans test subjects needed to carry out clinical trials would not take place. Whereas such traditional methods are still at the forefront of being viable for euthanasia. So, our conclusion about euthanasia, if I were to sum up our entire project, there is a lot of ethical dilemmas and concerns evolving around euthanasia, and we can see this as only a few countries and states in the US legally allow euthanasia. Even with euthanasia being legal in those countries and states, there's a lot of red tape and regulations that make it hard for most people to have euthanasia, including physician-assisted suicide. Patient conditions that warrant euthanasia are people such as dead brain patients, vegetative state patients, and patients in long-term coma. These people are given the right to access euthanasia under the consent of a physician, which would be called physician-assisted suicide, and the physician would take the appropriate actions to carry out such euthanasia, whether it's based on the patient being removed from life support or the patient um, being put on opioids or muscle relaxers. As such, we see that technology progresses to find different methods that will fill euthanasia that I discussed before as painless as possible. But as even if those methods were to pass on to clinical trials onto humans, the debate on how ethical euthanasia will always be everlasting. Thank you.